Okay, let's jump in. Think about this. There's this tiny butterfly-shaped part right here in your neck, and it pretty much runs your whole body's energy system. Today, we're doing a quick deep dive into the thyroid gland and why checking it properly is so important based on what we're seeing from Blood Test UK. Yeah, our goal is really simple. We're looking at the research from Blood Test UK, focusing beyond just the basics. We want to show you how these really detailed checkups, especially like the ones they mention in specific guides about localized testing, give you insights that honestly change things.
Absolutely. And what's really key here, I think, is focusing on catching things early. Finding those subtle issues now. Before they snowball into much bigger health problems down the line, it's shifting from just general screening towards really personalized preventative care. That's really the main takeaway we got from the source material.
Okay, let's break it down super simply. This butterfly thing in the neck, what's it actually doing? It sits there making these two main hormones, T4 and T3. Think of them like the gas pedal for your body. They control your metabolism, growth, how you use energy, basically everything keeping you going.
That's a good way to put it. The gas pedal analogy works. But there's another layer. If T4 and T3 are the fuel, then TSH, that's thyroid stimulating hormone. TSH is kind of like the message from your brain saying speed up or slow down. And when the thyroid gland itself isn't working right, maybe too slow or too fast, TSH is often the very first thing to change. Sometimes long before you actually feel anything's wrong.
Right. And that's the crucial part, isn't it? Those subtle changes, the ones you don't feel, I think they're called subclinical issues. That's why the basic tests, maybe just checking TSH alone, can miss the bigger picture. So if we don't catch it early, what are the biggest worries? What happens down the road?
Oh, the list is pretty long because the thyroid affects, almost everything. Untreated problems, especially hypothyroidism, which is the most common one, they seriously increase your risk for heart issues. We're talking high cholesterol, heart disease, big stuff. And it doesn't stop there. It can impact fertility. It can make your bones weaker, leading to osteoporosis. So getting tested early is genuinely the best way to prevent these really major long-term consequences.
Okay, so if the basic tests might miss that early shift in TSH, or maybe don't show the active hormones properly, we need something more thorough. Which brings us back to the advanced testing that Blood Test UK talks about. They mentioned facilities with better tech, like in the Salisbury area, for instance.
Exactly. That localization aspect is interesting. It suggests access to, more comprehensive testing panels. They don't just look at TSH, they measure the whole set. TSH, yes, but also free T4, the storage hormone, and free T3, the active one. And crucially, they test for thyroid antibodies too.
Antibodies, why are those so important to check?
Because they often explain the why. Why is the thyroid misbehaving? If you find thyroid antibodies, it strongly suggests an autoimmune issue, like your own immune system is attacking the gland. Hashimoto's disease is a common example. So advanced testing gives you benefit number one, super accurate answers. It gets to the root cause, not just the symptom level. It picks up those subtle hormone changes and the underlying autoimmune problems that, frankly, basic tests often just miss completely.
I see. And once you have that kind of accuracy, that detailed why, it unlocks the second big benefit, right? A properly tailored plan.
Precisely. Benefit two, the best, most customized plan. You get away from just a standard prescription based on one number. If you do need treatment, say medication like levothyroxine for hypothyroidism, doctors can adjust the dose much more precisely. They'll consider not just TSH, but your free T3 levels, your age, weight, whether those antibodies are present, everything. This kind of individual approach leads to much better outcomes. Patients feel better faster, and there's less of that back and forth trying to get the dose right.
So wrapping this up for everyone listening, what's the bottom line? This advanced testing, it's accurate, it's personalized, and it's really focused on prevention. It seems like the clearest route to getting a full diagnosis and protecting yourself from serious downstream stuff like heart or bone problems by keeping that little energy engine tuned up.
Definitely, and maybe connecting it to a slightly bigger picture. We know thyroid issues can run in families, they're often hereditary. So thinking about that, how does understanding your own detailed results, knowing the why behind your thyroid function, change how you might talk about health with your kids or your siblings? What kind of preventative conversations does that open up for you personally? Something to think about.
That's a great point. And one final practical thought. We really do recommend checking out the detailed guides on the Blood Test UK website. They've got some really important prep tips. For example, they mention stopping biotin supplements for at least 2 days before your test. Apparently, biotin can interfere with some assays and mess up those crucial free P4 and T3 results we were just talking about. Good to know.